A health advocacy group is now calling on the FDA to ban the weight loss drug Alli. That's the only over-the-counter diet pill which has been approved by the agency. They also want to ban its prescription counterpart. It's a stronger dose of the same drug. That one is known as Xenical. The petition alleges some patients have experienced serious health problems while taking the medications. Joining us this morning with more, medical correspondent Dr. Jennifer Ashton. So, Jen, these are the same drug.
Right.
Xenical is the stronger prescription version.
Correct.
What is it? There have always been some sort of issues, I guess, or talk about some of the side effects.
Well, to begin with, Erica, when you talk about a diet drug, one of the benchmarks that it needs to meet in order to be called effective is that patients taking it need to really lose 5% of their starting body weight. Now, with these drugs, patients lose a little less than that. They lose 3%. They do work. They are effective, but they can have some side effects and downsides, and particularly because the way they work is by preventing part of the fat that someone ingests in their diet from becoming absorbed. You can see some rather unpleasant gastrointestinal side effects, some diarrhea, that really can restrict the way that these drugs are taken in terms of the people who are taking them.
And so we had heard about some of those side effects from the early days of when these came out. But now there is this group, Public Citizen, which is a health advocacy group, identifying some other health problems, dealing specifically with organs. They say those are related to this drug.
That's correct. So let's look at what they found. And they got these, by the way, from the FDA's adverse reporting database. What they found was 73 cases of kidney stones. They found 43 cases of pancreatitis, and they did find some rare cases of liver failure. Now, when you look at these numbers, it's very important, Erica, to consider the denominator. Millions of people have taken these drugs over a 10-year period. That's when Xenical, the prescription medication, became available. To get incidences of 47 cases of pancreatitis or 73 cases of kidney stones, while serious for those people, obviously, if you make that into a fraction, these are largely safe drugs. Every medication has side effects, and that's what we're seeing here.
GlaxoSmithKline makes the drug, says Alli is, quote, the most studied weight loss medicine. Its safety has been established through 100 clinical studies involving more than 30,000 patients. So, always talk it over with your doctor, as you said. Should we be concerned, though, if someone's taking this drug?
Well, I think you absolutely should discuss it with your doctor. We also need to remember that because Alli is available over the counter, kids can get these, teens can get them, adults of all ages. This is an obesity epidemic, so yes, it's something you need to discuss with your doctor and weigh for yourself whether the risk is worth it.
Especially since you're not really losing that much weight. Diet and exercise, huh?
Correct.
Jen, thanks.
You bet.